This presentation is brought to you by Brain Core Therapy. Many people ask, what are anxiety disorders? How do I know if I have one, and what treatment options are available? Here are some helpful tips for understanding combating them. There are several types of recognized anxiety disorders, and each come with incredibly different symptoms. In order to determine the best course of treatment, we must examine the different disorders and the range of treatment options available. Anxiety is a natural human emotion. Feeling anxiety once in a while when faced with a challenge at work or before a test is completely normal. However, anxiety disorders completely disrupt a person's life. They are constant and can be overwhelming, and sufferers need to find a course of treatment that works for their specific disorder. Some common anxiety disorders include obsessive-compulsive disorder. People with OCD have repeated and unwanted thoughts, ideas, feelings, behaviors, and obsessions that make them feel driven to perform certain rituals or do things a certain way. People with this condition have sudden feelings of terror and fear that occur with little to no warning. Physical symptoms include heart palpitations, trouble breathing, sweating, chest pain, and the feeling of having a heart attack. Phobic people have persistent and irrational fear of a specific object or situation. The level of fear is usually disproportionate to the situation and often interferes with the person leading a normal life. The symptoms of anxiety disorders can vary greatly depending on the type of disorder. Some key things to look for are excessive worrying or anxious thoughts, trouble falling or staying asleep, overwhelming self-consciousness, irrational fears, near constant muscle tension, and panic attacks. Just because you show one of these symptoms does not necessarily mean you have an anxiety disorder. A doctor must be consulted before a diagnosis can be made. There are actually a wide range of treatment options, and not every treatment works for every person. You should carefully consider your options and try out as many treatments as possible to ensure you find a method that works for you. Drugs like antidepressants and anxiety medication are commonly prescribed for anxiety disorders, but they also carry a high risk of dependence and negative side effects. Psychotherapy involves working a mental health professional who focuses on the emotional response to anxiety disorders. The therapist helps the patient develop strategies for coping with their disorder. Cognitive behavioral therapy focuses on teaching the patient to recognize and begin to change some troublesome patterns of thought and behavior. The goal is that eventually the patients are able to stop themselves before they fall into destructive habit patterns. Neurofeedback therapy is a therapeutic method of exercising the brain that seeks to guide dysfunctional brainwave patterns back to normal, organized patterns. By doing this, the brain is able to operate efficiently and properly. Neurofeedback therapy has no serious side effects and has been shown effective in managing many neurological conditions, including anxiety, panic attacks, and insomnia. If you want to learn more about neurofeedback therapy, please visit the link on your screen. Dietary and lifestyle changes can drastically help with anxiety disorders. Avoiding caffeine and alcohol, eating real organic foods, and keeping a normal sleep schedule can significantly improve anxiety disorders. Taking care of yourself and avoiding unnecessarily stressful situations can be help in combating detrimental symptoms. For more information, please visit our website at www.braincoretherapy.com.